All right. Hi, everybody. Happy Wednesday. It's right at 5 o'clock. We'll get started. I have a good amount of information to go over tonight for you that I think will help you a lot. It's going to be on the gut and the digestive system. So I think that's going to be great. First, I want to welcome those of you that have been on. I've received some really great feedback um, that you're enjoying the classes and the information is presented. Um, in a well articulated way that you can understand it. And I appreciate that. I know there's some things that we're always going to be cleaning up and working on each time. And then when we do the class again down the road, we're going to figure out the moderator and somebody that can help out as well. So we're constantly working on it. I love the fact that I'm able to sit here and give you this information that over the last 20 years or so I've learned and gathered. So welcome. If you've been on the class before, welcome back. I appreciate you. And then if you're new to the class, I want to take the opportunity to welcome you as a first timer. My name's Dr. Roney. I will be hosting the class. I'll be teaching, some of the conversation topics, and then other times I'll pull doctors on and clinicians on that can help me in areas that I'm just not, that I don't feel as comfortable talking about from an expertise standpoint. So those of you that have been here, thank you for coming, and those of you that are new, again, take the opportunity to welcome you here. I've talked to a lot of you, so if the first 5-10 minutes I'm going to do a review, you can always hit mute, get some things done around the house or what have you, because the first 5 or 10 minutes is always going to be a review. I think that's imperative. Some of you get it and don't need it, but a lot of you do. And I think it's really, really important. So we're going to do a review of what we've gone over so far. And then moving forward tonight, I should say, we're going to do the digestive system and the gut. And I think you're going to love that one. And then also the future classes is going to be or are going to be on all the causes, right? So last week we talked about inflammation and immune dysregulation. This week we'll talk about gut health and how that impacts that inflammatory process. We'll talk in the future about everything from toxins in the body to infections like bacteria, viral, fungal infections like candida and mold. We'll look at the mycotoxins. We'll look at heavy metals. We'll look at stress and cortisol hormone connection. We'll look at thyroid and blood sugar. We'll look at electromagnetic fields. So, and there's more, exercise, and we'll do diets. I think next week I'm going to have, or next class I'll have Liliana on, because tonight I'm going to talk about the gut. And then I think it's probably a good segue into the different diets that are out there and ones that are highly recommended. So somebody said, Jackie, yeah, Jackie's been with me for a long time. So she said, keep doing the review. It's helpful. So absolutely, I think it is imperative. So if you're new to the conversation, what I want to tell you is from a purpose standpoint. Just briefly, I had skin cancer back in when I was 28, melanoma. I had my dad passed away of asbestos and smoking related lung cancer that same year. And it put me on this journey of trying to figure things out. And so the last 25 years of learning functional medicine and learning integrative care and being at the center and learning from Dr. Keneally, I kind of feel like I figured it out, for myself, for the patients that I work with and or my family members. And I think the plan that we implement here, I think it's fantastic. And it's personally, I tell everybody this, it's exactly what some of my family members are doing right now here. And it's exactly what I personally would do, or how I would think as to my approach based on all these years of trying to figure it out for me personally, as well as a healthcare practitioner. So I think purpose-wise, that's my passion. That's my purpose. It sounds corny, but I really couldn't help my dad back in 1998 because I was very new to learning about this. I was literally a baby or an infant even, and I just didn't have the knowledge. So this allows me, you all allow me to fulfill, I think, a little bit of vindication where I couldn't help him, but all this data that I've collected and learned that we do here at the clinic, and I've learned from all these wonderful people, I get to teach you. So I know, again, I know that sounds corny, but it really means something to me, and I appreciate you being on here, and I appreciate you giving me that opportunity. So it's awesome. So somebody just said hello from Philly. That's my hometown. I grew up in Westchester, Kennett Square. So we're neighbors. All right. So all right, gang. So let's talk, about the plan, right? So I mentioned last time that I was involved in baseball and college baseball and at a high level. And the coaches that I've had were at 8 World Series and won 5 of them, right? So that's not to impress you. That's really to impress upon you something. What I learned from them is the reason that they're successful is because they had a plan, they had a vision first, then they had a plan, and they worked the plan relentlessly. And because of that, their outcomes were more predictable. They left very little to chance. And I hope that makes sense because that parallels into this 4-pillar approach that we've worked on diligently here, getting in place, because it's thorough, it's well thought out, number one, it's well researched, number two, and it is a plan that, if implemented, in my opinion, strong opinion, and I'll teach that, I'll do the review, and then I'll teach some of these causes that apply to it. It gives you the best chance to heal, in my opinion. And I've looked at a lot of different clinics. I've looked at a lot of different places for me personally and for family members. This is good stuff. But I don't want to just tell you that. I want to show you why that is. So let's talk about the 4 pillars, right? It's about 7 after. I'll try to get through this in about 5 minutes, and then we'll get started. So pillar number 1 of the 4-pillar approach is going to be the testing, right? So let me go ahead and share the screen because I want you to see the PowerPoint while I'm doing this. See, a couple of weeks ago, I forgot to share the screen. That's bad of me. It's terrible. I've been doing this so long. So let's go and get right into the 4-pillar approach. So the first pillar is going to be the testing. So most of you have had or will have different CAT scans and MRIs and PET scans potentially, and you may have blood work related to your diagnosis and so forth, right? So we'll do all that too if you don't have it, or we'll repeat that for you during our process. But some of these tests that we're talking about are going to be things like the RGCC test, Nagalase, PHI, D-dimer, cancer antigens, things like that. And I was just on a phone call not too long ago with patients from back east, and they're going to come out here. And I went through this process with them, and they loved it, and they should, because the RGCC test, as an example, is a test that will tell you sensitivities to your chemo agents, right? So if chemo or low dose chemo that we do here is an option, the RGCC test is imperative. Number 2, it'll tell you that the natural agents that are going to be most beneficial to you or that you're most sensitive to. It will also tell you repurposed drugs, right? There's a book, How to Starve Cancer. It will talk about these repurposed drugs that you're most sensitive to. So when we want to starve some of the pathways that feed cancer, we can use these medications to do so, and based on specificity, right? Based on what's best for you. And then finally, it'll test the circulating tumor cells. So pillar number 1 is all about testing, but even more specific than the conventional model in that it's going to be specific to you, right? And I don't think there's a better plan than having a more individualized approach to you and your diagnosis, right? I think that's imperative, but I also think that's super remedial too. Like, who wouldn't do that, right? So anyway, there's clinics that don't use it that might say, hey, it's not worth it or it's not relevant. Personally, I vehemently disagree. I don't see why you would do a blind, go into it blind. And again, if we're trying to maximize our upside, which that's all I think about constantly, how am I going to maximize my upside? How can I maximize my upside for my family? Well, the RGCC is a way to do that. Okay. Second, you'll see tests like Nagalase. Nagalase is an enzyme that's secreted by the cancer cells that will actually cause your immune system to be blocked. It won't, it basically protects the cancer cell. Nagalase will. So if that's up, we want to bring that down. If PHI is up, it's an enzyme that, it shows that cells are anaerobic. They might be feeding on sugar or going through glycolysis. So we want to make sure that we oxygenate the environment. Well, hyperbaric and things like ozone would be specific to knocking those down. D-dimer is one that tells us that the cancer might be traveling a little bit. It's a coagulation factor. So if that's up, we also want to bring that down. So again, these are just some examples. There's more tests. Some of you had these tests. Some of you may not have had these tests. It's all dependent on you and what the doctor needs to look at or wants to look at. But these are tests as an example that start individualizing the care. And again, I always, probably will be beating this dead horse, but the reality is that plan makes perfect sense to maximize your upside. So the testing is imperative. All right. Pillar number 2 is going to be starving the cancer, killing the cancer, oxygenating the environment, and alkalizing the environment, because it's shown that cancer doesn't thrive in a low oxygen and high acidic state, or it does thrive, but it doesn't thrive in a high oxygen and a high alkaline state, right? So we want to make sure that we get you more alkaline and we get you more oxygenated, right? So starving the cancer is going to be about, those repurposed drugs that block the pathways that attack cancer, right? Or feed cancer, I should say. And then secondly, your kill phase would be everything from chemo, radiation, right? It could be surgery, and sometimes that's necessary, gang. So I don't want to sit here and poo-poo what the conventional model does, right? Because that could be life-saving for some people. However, we want to make sure that if we can use low-dose chemo or less invasive measures, that we do. That's our philosophy, right? Do no harm. And so low-dose chemo is basically when you're going through chemo, we take the chemo agents from the RGCC test, right? And bring your blood sugar down via insulin. So we inject insulin, bringing the blood sugar down, and then infuse those chemo agents. And what happens is when the blood sugar's down, it basically, the cancer cell is kind of starving, so it acts as a vacuum and it pulls the chemo agents right into it. So because we do that that insulin potentiated, where we bring the insulin down, kind of starve the cancer cell, infuse the chemo agents from the RGCC, we can use less chemo, right? So instead of 100% strength, we might use 10%, 20%, something like that. So there's typically less damage to the cell, and there's less, or to the surrounding environment, and it targets the cell specifically. So again, you use the RGCC test to get the chemo agents, and then you use low-dose chemo to target the cells. So people typically don't get nauseated, they don't lose hair, they maintain a very good quality of life with it. So the kill phase could be that, or it could be, conventional chemo, surgery, or radiation. It just depends. And our recommendation would depend on all that data that comes back from pillar number 1. Okay. Then pillar number 3 is going to be your different immune boosting modalities. So if I'm doing, well, first of all, if I have a chronic disease like cancer, my immune system has become very dysregulated. So we need to regulate it. So there's certain supplements. We mentioned things like vitamin D. Last week, we mentioned things like omegas and short chain fatty acids, and we mentioned turmeric and resveratrol and things like that to really pour water on the fire, right? But then also we need potentially vitamin C IVs, right? High level of vitamin C and mistletoe and some of these other immune boosters that we have. So the point I'll make is very simply is we always want to do pillar number 3, no matter what you're doing. If you're doing regular chemo, we want to do pillar 3 because chemo is proven to beat the immune system down, right? So then you're more immune compromised. We don't want that, and you get tired and you get a lot of symptoms. So if we can boost your immune system simultaneously, I think it speaks to itself as to the importance of that, right? And then finally, which we'll start talking about tonight, are the causes, right? So as Dr. Keneally says, there's a 10-year process of a tsunami, a hurricane, and a tornado that potentially is going on in your body. And we want to make sure that we understand and uncover. So again, I just had a conversation with a patient back east, and I went through these causes. I went through things like inflammation in the body. I went through gut health. I went through the diet and toxins and chemicals and infections in the body and stress and so forth. And so I went through that list, which are the causes. And I said, hey, what do you think may have caused this? And right away, this patient went to an episode maybe 7 to 8 years ago that she had a mysterious infection. They thought maybe it was mold or Epstein-Barr. They weren't sure what was going on, but she had a lot of joint pain and aches and pains and really just felt bad, right? For a good while. So she felt like that may have facilitated things, and then a ton of stress in her life. So, with those things, when we're looking at causes, those two things for that patient go to the top of the list as two things that we want to start looking at. So stress, and she felt like maybe mold exposure. I don't think I mentioned that, but she felt like mold exposure. And mold exposure, affects the body in the form of mycotoxins. And we'll talk about that in a separate class, but each class moving forward is going to take a specific cause, right, and break it down. So tonight is going to be the digestive system. So hopefully, what time? So 17 after. It's a little long for the review. I know I can get wordy. I apologize. But okay, so hopefully that makes sense. You have a 4-pillar approach: the testing, the starve, kill, oxygenate, and alkaline phase, the immune boosting, and then figuring out the causes. All right. Phenomenal plan. Dr. Keneally has done an unbelievable job of putting together the resources here, and the details for this plan for patients to be able to take care of a lot of this, if not most of this, under one roof. So pretty good stuff. Okay, so causes, right? Let's talk about real quick a review, because this goes back to last week and a couple sessions before. Number one, we're going to have fuel or causes that ignite a fire. So let's think about that. In our bodies, the way I can articulate it best, I think, we have this campfire. And think of a campfire as very controlled. We have a couple logs on there. The fire's keeping us warm, but it's not out of control, right? That's a good thing. But think of an inferno, a full, New York skyscraper on fire, and the inferno that is ensuing. Your immune system could either be a campfire or an inferno or something in between. Either way, that's not good, because that fire will cause immune dysregulation, okay? And that immune dysregulation, if you remember from a few classes ago or conversations ago, and if you weren't, I'll explain it, will cause free radicals. A free radical is an atom, right? If you remember from high school or college biology, an atom that loses an electron, right? So there's paired electrons. Maybe some of those pairs are losing an electron, and that becomes an unstable atom. And when it's unstable, it causes damage. And one of the things that causes is oxidative stress. So oxidative stress is very similar to rust on a bicycle, right? So it's damaging. So what's happening, those free radicals, because of the inflammatory process, is causing oxidative stress. That oxidative stress, okay, will cause damage to this cell, the DNA and the genes that cause it to go through cell death, right? So as cells get old and damaged, they're supposed to die off. It's called apoptosis. But if oxidative stress is affecting those cells enough, the things that cause it to go through cell death are broken. So these cells that are damaged, that are old, replicate out of control, okay? And then if they replicate out of control and they don't go through cell death, that's cancer. So these cells that replicate out of control because of oxidative stress, because of free radical damage, because of immune system dysregulation and the fire that ensues, that's what happens. So here's a simple idea. We want to pour water on the fire, on the inferno. And the things that we talked about last week, like vitamin D, is one of the best things. And I mentioned glutathione because it is one of the best things, but with cancer patients, we have to be very careful with glutathione because there's evidence to show that glutathione protects the cancer cell. So No glutathione for a cancer patient, but I wanted to throw that out there. We look at omega-3s, we look at resveratrol, we look at turmeric. All those different things are, and there's more, but help pour water on the fire. But the critical element here to stop this entire process is to take away the gasoline, propane, or diesel fuel that's being dumped on your fire, right? So your immune system is basically being overran or overrun by these fuels. And one of the most important fuels that we talk about comes from your digestive system. Okay. So let's talk about that. Hopefully that makes some sense, right? Like this, that fuel and fire analogy, I think works really, really well. We want a campfire. We don't want an inferno, because when there's an inferno, we have free radicals that cause oxidative stress, that cause damage to the DNA of the cell and the genes, and the cells no longer die off, and they go through poor cell replication, which leads to damaged cells and cancer. Okay, so that's the pretty much the main mechanism of this thing. Okay, so let me take a quick drink of water here. All right, so this is big. Your digestive system, important gut facts. Okay, 70% or more of your immune system is housed in the gut, right? That's significant. Now, there's some studies that will say 70, 80%. So don't hold me to the 70, but let's just say most of your immune system is right there in your gut, in your digestive system, right? It's also known as the second brain. Now, what that means is the next statement there is a gut-brain connection and a brain-gut connection, right? So say my gut's bad. I have, and we'll go through this, I have poor digestive enzymes and hydrochloric acid. I have a bad microbiome, which means I have too much bad and not enough good bacteria. I have leaky gut, which we're going to talk about, and I have infections in my gut. Guaranteed that's going to create inflammation. That inflammatory process is going to affect my brain significantly. I could have anxiety, depression. I could have a word recall issues. I could have brain fog. I could start to get neurodegenerative symptoms, etc. So there's nerves and nervous system pathways, the vagus nerve, the enteric nervous system, not to get too nerdy on you, but those get affected, and those help send signals back and forth from the gut to the brain, and then from the brain to the gut. So hypothetically, if my gut's bad, my brain can be bad. If my brain is bad, so I have a history of concussions, from car accidents, sports injuries, what have you, and I have some inflammation in the brain, I guarantee your gut's going to be affected, right? So there's that connection between the gut and the brain and the brain and the gut. So anytime I'm working on a patient with gut issues, we're certainly looking at their brain function to make sure there's no major neurological defects going on, or degenerative type of symptoms. And so some of the paperwork I personally give asks patients about their brain health, and it's about 2 to 3 pages long, because I want to put the entire picture together, right? Okay, many of your feel-good neurotransmitters are produced from the gut bacteria, including serotonin, dopamine, and GABA. So your neurotransmitters are things that sit in, like if I have an impulse going from one nerve cell to another, there's a gap there. Neurotransmitters fill that gap and make that nerve flow, or that impulse flow really, really well. If I have low serotonin or low dopamine or low GABA, I'm going to have, like, my serotonin is my feel-good neurotransmitter. So I'm going to kind of be like low. I'm going to be not really happy, and kind of down. And GABA, as an example, if that's low, that's your brake pedal. So that's somebody, if they're low on GABA, their brain's working overtime. It never shuts down because they don't have enough of the brake pedal. So when we start to see changes in the brain, it's rarely primary. It's usually what's going on from the neck down, and the gut is a primary area that we want to look. Okay. So stress impacts the gut significantly. Well, how would that be? Well, as far as this concept called fight or flight. So if I'm under fight or flight, which is that stress response, somebody coming up behind me on a dark alley, I get that, I either have to run like heck or fight like heck. And you have chemistry that's released in order to allow that to happen, right? Well, if I'm in fight or flight constantly, there's another part of the nervous system of that autonomic nervous system called the parasympathetic that is supposed to be responsible for rest and digest. So if I'm stressed a lot, then I'm sympathetic overload, which is overriding my ability to rest and digest, which affects the gut immensely. So it could create too much acid production, nervous stomach. It could affect leaky gut. It could affect your microbiome and create an environment that's really conducive for bad things to grow. So stress is a major player. So again, if I'm working on gut, I'm checking the brain, I'm checking the stress response as well, cortisol, things like that. And then poor gut health can cause immune system dysregulation. This is the key, right? Inflammation, which then leads to free radical formation, oxidative stress, and chronic disease like cancer. Also, brain degeneration, malnutrition, eczema and skin issues, autoimmune disease, and many other chronic issues. So the gut, the reason I put this slide up, I wanted to start with showing how important your digestive system is to your overall health, right? And for a lot of you, pretty simple concept, but if I'm trying to eat healthy, right, and support my body so I can heal from this disease, and I'm eating healthy and I'm taking supplements, but I have a bad gut, and if you've been with me and have seen me, I pretty much highlight gut health with every patient that I see. I usually review NutriVal test, and that's the first thing I look at. Had 2 patients today, both of their guts were really, really bad. And it's something that I prioritized highly that we need to work on. Because if I'm not digesting my nutrients properly and I'm not digesting my supplements properly, it's kind of like swimming upstream, right? So it should be an early, a place to start looking early on in somebody's healthcare process. Okay. So let's talk about the digestive process. This is remedial, gang, but I think it's good to have visuals. So when I'm talking about these different areas, where I'm talking about or what I'm talking about. So the digestive process here, the foods obviously go in the mouth and they'll go down the esophagus, right? This is that soft tube that goes all the way down. Sorry about that. There is a sphincter here where food goes in, and once it goes in, the sphincter closes, right? And then it's supposed to not go back out. If we have reflux, then something's wrong with that sphincter there, right? So anyway, food goes into the stomach and it becomes a mixture, and the mixture is called chyme. When it's mixed, it's going to mix with digestive enzymes and hydrochloric acid, right? Amongst others. And then it's going to loosen up and it'll go into the small intestine. In the small intestine, it's further digested by the pancreas enzymes, right, to help break down proteins mainly, but some carbs and fats. And the liver produces something. Here's the liver over here, and that's on your right side. So this is looking just opposite. So right side is liver, gallbladder. Left side is your pancreas. Somewhere kind of in the center to the left is your stomach. Okay, if you're trying to figure it out in your body. So foods go into this small intestine, which is very, very long, roughly about 24 feet long. So all this maze here that you see, right, is small intestine. The first third of that small intestine is where a lot of the absorption of foods take place. So food will go into that small intestine. If it's broken down properly, and we're going to talk about issues that happen, foods will permeate through these tight junctions and it will feed the cells, and that's called assimilation. So we have kind of digestion and absorption and assimilation in the process. It's a little bit more involved than that, but that just gives you an idea of what's what. So the foods, if they're broken down properly and small enough, can get through that gut wall and into the bloodstream to feed your cells. So there's a lot of things that I'm going to talk about that are important to work properly for all that to happen. And then the large intestine, which is here, right, goes all the way down and around. So it'll start here on the right side. Can't see me, but I'll pop down. So it'll start on the right side down here. It'll go up all the way around your diaphragm and your rib cage, and then over to the left, and then it'll go down and out. And that's where the fecal matter goes. So out the anus, right? So that's your digestive system. And it'll help to understand that as I move forward. So I thought I'd do a remedial review of that. Okay. All right. Now, what can go wrong? Here's the deal. So one of the things, especially with these chronic diseases, I believe firmly that the food supply that we have now, and I'm going to talk a little bit about this, but next week I'm going to have Liliana on and we'll really get into depth about, foods and diets and things like that. But the food choices, right? So if I'm making bad food choices, a lot of processed sugars and processed grains, and not eating more of a farm to table type of mentality, my body's going to have a hard time, right? Over time, those foods aren't going to get broken down properly, and they're going to create inflammation in the gut, among other things, right? So, one of the biggest things that I could tell you that we try to avoid and we want to lower is inflammation in the body. Okay. The foods and the digestive system can be one of the major players as to inflammation in the human body. Okay. So, foods, right? We want to clean them up, and we want to be as clean as possible, right? Farm to table, living off the land. I always say, if I'm on a deserted island, what could I eat? Whatever's there, right? I can pick it or chase it. Now, I understand the meat thing. So if I personally have a little bit of meat, it's going to be free range, free roaming, right? It's not going to be the processed meat that you see and the junk that's fed to them, and steroids and things like that, and hormones to beef them up. It's not going to be any of that. It's going to be real clean, wild like. It almost tastes a little gamey, right? But mostly I'm going to do plant-based protein. I'm going to do really good fats like my avocados, my good oils, my nuts and seeds raw. And then, so I'll have a good amount of fat in a meal. I will have a good amount of plant-based protein. Once in a while, I'll do some meats or fish, wild fish, of course, smaller. And then I will be conscious about my carbohydrates. So I do a lot of greens and a lot of low glycemic fruits like berries. But I will have a sweet potato, small sweet potato here and there, some quinoa. I'll do some brown rice once in a while. But I look at my carb load over the full day, and that's how I gauge it, right? So I'm more what I would call healthy fat, and good healthy protein centric, with lower amount of carbohydrates, I would say. But I live off the land, all organic, free roaming, free ranged, etc. Okay, so that's the food stuff. Now let me explain briefly the gluten thing, right? Because I'm going to use that as an example of what happens when I put something like gluten, or the proteins called transglutaminase, in my body. Now let's go back a step, because this is important. I have this conversation all the time. The way we farm now, the way we hybridize the seeds for wheat, makes the wheat, by the time it gets to our digestive system, very difficult to digest. So in a lab, they're basically trying to find how to modify the seeds so it takes less water, right? Or it lasts longer on the shelves. It's more insect repellent, right? The bottom line is, when they change or modify foods, they're changing it for the sole reason of it lasting longer for the most part, and increasing their or decreasing their loss of money. It all comes back to money, gang. When you really delve into this, it's all back to money. So it's okay. I understand why they do it. They have a lot of people to feed, but we have to be aware of this so we can navigate properly. So a gluten, for example, a seed, right? They hybridize it, they genetically modify it, and then by the time it gets to our system, it's processed. There's up to 25 new proteins that are made in the human body from wheat nowadays, because of that process. Our bodies don't have the capability, the digestive enzymes, to break it down properly. So when it gets into the small intestine, and I'll explain this, it's not a single amino acid form. It's not in our single amino acid. They're clumped together. And when those amino acids are clumped together, because our digestive system can't digest this new wheat, your immune system comes along and looks at it, and it's a foreign invader. So what the body does is it attacks it, just like if it's a virus or a bacteria. So that's where wheat, as an example, creates copious amounts of inflammation in the body. It's because of the way they process it now. Now, European grains, a little bit different, because Monsanto and some of these other companies didn't get involved in all this and change things, right? So it's cleaner the way it was years and years ago. So as an example, the wheat has changed, so the way we digest it changes, which creates inflammation in the body. So that's called a food sensitivity, Okay, not to get too nerdy, but there's a different immune reactions. There's IgM, IgA, and IgG. A food that would create an instant response, not necessarily anaphylaxis. Anaphylaxis, I eat a peanut, my head goes and I can't breathe, all that. That's anaphylaxis. But an IgM reaction could be if I drink some milk, like dairy, pasteurized dairy, and I start to get a histamine response and I get mucusy. That's an IgM reaction, right? An IgG reaction, as one of the immunoglobulins, it can be a reaction up to 72 hours later. So I could have eaten something, what's today, Wednesday, on Sunday, and I could have a headache today because of that IgG reaction. So there's food sensitivity testing, and I'll talk about those, that can be done to identify these IgM versus IgG reactions. Not only that, there's testing companies that can look at raw foods versus cooked foods. So how about this? 3 to 4% of people react to raw eggs, but 55% or more of people react to cooked eggs. So when you cook something, you denature the protein and it becomes harder to digest because we've taken out the live enzymes that help break it down. I'm throwing a lot at you, but I just want to give you an idea of how these foods can play a factor in our immune response. So again, lowering inflammation is the key. If we put good things in, and then the next step is we have enough acid, which I'll talk about, and enzymes in the gut, we're going to have a better chance to break these things down. So the second thing is not enough acid or enzymes in the stomach, which will equal poor breakdown and poor absorption. We don't want that. And then undigested foods, especially proteins, will create an immune response, right? And inflammation. And then what's the next step in inflammation? Free radical, then oxidative stress, then you know the deal, right? We've gone over that. So that pathway, we don't want the fuel to the fire. So again, having enough enzymes and putting enough good food in our body is critical so that when it gets to the small intestine, it is not inflammatory. Okay? All right, so hopefully that makes sense. Poor diversity of bacteria. They call this dysbiosis, right? So if I have too many bad and not enough good bacteria, I am going to have a problem, and it's called dysbiosis. When I have dysbiosis, it can set the stage for infections. It could set the stage for candida, overgrowth of bacteria like E. coli, for example. It could set the stage for parasites, set the stage for something called SIBO or SIFO, which is small intestinal fungal overgrowth. So your microbiome and the health of your diversity of that microbiome, and when I say microbiome, I mean bacteria, is critical to the entire process, okay? And then we could have leaky gut, right? And I'll explain that in a minute because I have a whole slide on it because people ask me about it all the time, but it's very critical. But basically, if I have these undigested foods permeating through, along with toxins, chemicals, alcohols, things like that, lipopolysaccharides that get through the intestinal wall, the immune system in the bloodstream comes along, looks at it, says, I don't know what that is, so it's going to attack it. Inflammation, right? Immune dysregulation, free radicals. So it's another area or place in the gut where inflammation can occur. And then the fifth part is infections, and we already mentioned them. So I have bacteria, viral, fungal, parasitic, etc., in the gut. When my gut is not healthy, then those things can fester, okay? So if I have those infections, we definitely have to identify them and get rid of them because they are a major factor in the inflammatory process within the gut, and it will cause free radical damage. It will cause a poor microbiome, etc. Okay, so those are the things that can go wrong with your digestive system that can create inflammation, right? Which then creates the free radicals, which then creates the oxidative stress, the damage to the cells, and then they replicate out of control. So gut is imperative, not only for absorption of nutrients, right, and feeding your body the right way, but also because of this inflammatory process. So it's so significant in the overall health of an individual. I personally, it's like my number one thing that I assess and work on. Okay, so like anything, right? You know how I operate if you've been on here before. I'm very systematized. My brain works very analytically, right? So even within the 4 pillars and talking about the gut, right? The 4-pillar approach, which is a plan, right? Even within that plan, we talk about the gut. Even within the gut, there's a plan, right? Again, my brain just, it has to work that way. It has to compartmentalize these things. So the 5 R's protocol is a very common protocol in functional medicine. It's just how it's identified and basically implemented. But here we go. So the first R, right, and this is very important, is to remove those foods that we know are inflammatory, right, or we know have poor chance of getting digested well, etc. So to keep it simple, you go back to this whole paleo or farm to table concept of pick it or chase it. And if you don't want to do the chase it, then use your plant-based proteins, but be good with your fats, good with your plant-based proteins, and good with your lower amount of carbs, but the ones that come right from the land. Okay? That's the best and easiest way I could say to eat, to make it as simple as possible, to take care of the inflammation that your foods are giving you. It's either going to be medicine in a positive way, or it's going to be a detriment to your health. So I would consider strongly being, gluten-free, soy-free, dairy-free. And while we're on the dairy, people ask me about dairy. Dairy used to be raw, right? Years ago, years and years and years ago, it used to be raw, which means there's live enzymes that help break down the casein protein. Once they pasteurize it, right, and they heat it very, very high to kill off organisms and microorganisms, well, now you've cooked off all the live enzymes, right? So that casein protein, which is from a cow, right, it's very different biochemically than mother's milk. So we have a hard time digesting it already. But then when you pasteurize it, the human body can't break down casein protein well. It's one of the worst, most offensive proteins that you can ingest. So there's a lot of immune reaction to dairy. So that's why I'm big on no dairy, no gluten, no grains, etc. Okay, so we'll get into that next week. The second R is to replace digestive enzymes and hydrochloric acid. So if I'm putting this good food in, I better have enough acid and enzymes to break it down. Two things here, gang. Number one, as I age, we lose digestive enzymes and hydrochloric acid. Proven, okay? And number two, when I cook foods, I cook a lot of the digestive or live enzymes out of it. That's why your raw plant-based can be better. But here's the deal. If I do cook foods and I cook the live enzymes out, let me give you an example. If I cook an apple, right, and leave it on the table, and then I cut an apple and leave it on the table, the raw apple is going to have live enzymes in it that work together biochemically with oxygen, and it biodegrades. The cooked apple will stay there forever, right? A long time, pretty much forever, because all the enzymes are out of it. It's not going to have the same oxidative, oxygen is not going to have the same effect on it. So the point being is you're ingesting those cooked foods. You should be taking digestive enzymes in order to break it down properly. And I would include some hydrochloric acid. Now, there's caveats to that. It's not a blanket statement because some people might have an overproduction of acid because of H. pylori, or they have a hiatal hernia, things like that. So that's where an assessment is critical. So I'm not going to give you tonight any specific supplements to take. I'm just going to give you the big picture, and I'll tell you why as we move forward here. All right, third R, revive the microbiome. We have to test the microbiome to see what your bad bacteria looks like and the levels versus your good bacteria, okay? And once we find out, then we can give you very specific probiotics, right? Sometimes I got a patient today, we needed Saccharomyces boulardii because of the C. diff that they had, right? So C. difficile, toxin A, toxin B can be detrimental to the digestive system. Sometimes it's asymptomatic. Point I'm making is Saccharomyces boulardii was needed for that patient based on the test, plus something called Megaspore, which is a very good spore producing probiotic. But I use the testing to guide me. That's part of why I don't give just general recommendations of supplements for gut, because I want to be very specific based on the testing. All right, repair the gut wall, the leaky gut, okay? So I'll explain this in a minute, what the leaky gut is, because I have a good slide on it that our IT guy, Daniel, helped with, which I appreciate, Daniel, by the way. And then the fifth R is to remove those infections. But again, those infections, we have to test for the infections in order to figure out what the heck's going on in there, right? So backing up just a second, gang. Let me take a quick drink here. Sorry. Backing up just a second. Let's talk about symptoms, right? If you come in and you do have sensitivity reactions to foods and you know it, right? You get histamine response, you get bloating or gas, you have fullness in your stomach even after a little bit of a meal, you have irritable bowel or constipation or diarrhea, or you just have symptoms of ill gut health. That's the first sign and symptom, right? It's obvious. So then what we want to do is assess everything, like we talked about. We want to assess your adrenals. I want to assess your brain health, because I want to see if it's the gut brain or the brain gut, right? I want to see if the stress is impacting all of these different things. Because if I'm working on your gut and not addressing those other things, and I see this a lot with patients that come in, they said, I've been working on my gut forever, but they didn't address stress or they didn't address their brain health. It's going to come back, right? So the point I'll make is a very good, history along with paperwork that asks the right questions can start to narrow in the focus from the Pacific Ocean down into a puddle of water this big, that we can start getting answers and specific answers if the right testing is done. And then again, if there's hypothetically, say SIBO, if you've never heard of SIBO, it's small intestinal bacteria overgrowth, right? So what happens is, and again, I don't even know if I wanted to get into this, but we have time, so I will. Okay, so SIBO is small intestinal bacteria overgrowth. So if you remember the small intestine, that long one, 24 feet long, that connects into the large intestine. Well, when they connect, there is a valve there called the ileocecal valve. That ileocecal valve, if it doesn't close properly, right? As an example, bacteria from the large intestine gets through and starts to translocate into the distal end of the small intestine, right? And that bacteria doesn't belong there. So it overgrows. And then when the body is introduced, or you're introducing your gut to starches, for example, those bacteria feed on those starches. And when you have those starches, fermentation occurs, and methane and hydrogen gases are produced that create copious amounts of bloating and gas. Okay, so if you eat and you get a lot of bloating, you probably have this bacterial overgrowth. So let me give you an example of how we treat this. We might give you things to kill the SIBO, right? To kill the bacterial overgrowth, and I'll talk about that in a second. But here's the deal. Why is the ileocecal valve not closing? I'm going down a road, gang, that most practitioners, a lot of practitioners that have experienced, aren't really aware of. But if you think about that ileocecal valve, it's under control by the vagus nerve. The vagus nerve, remember the gut-brain connection? The vagus nerve is a critical nerve in your body that controls pretty much a lot of your gut. And the ileocecal valve is one of those areas. Low thyroid could cause a slow ileocecal valve or vagus nerve reduction. Head trauma can cause it. I mean, a bunch of different things can cause the ileocecal valve not to work well. So if I'm going to fix SIBO, as an example, this is the plan within the plan, I'm going to have to help the vagus nerve. So things like smiling, singing loudly, humming, right? Gargling, gag reflex, all these things stimulate the vagus nerve. So if somebody has that ileocecal valve issue creating SIBO, and that's never addressed, they'll get rid of SIBO, but it'll come right back, right? So the point I'm making is, even within the gut, the 4 pillars is a great plan. Then you have these causes, the gut, then there's a plan within the gut, like the 5 R's plan, but then within the 5 R's plan, there's another plan, right? That's how, if you're good at functional medicine, you understand the brevity and the depth of all this. That's how you get people well, right? I've been lucky enough to just study under some really good people that go into this kind of depth with it. But that's just an example of another plan within a plan, okay? So again, infections, SIBO, SIFO, candida, parasites, bacterial infections, viral infections, etc. All important to be able to identify, okay? Now, let's talk about leaky gut, because I think this is really, really important. So if you see up here on the left here, what we have here is, if you can see my pointer, and hopefully you can, this is food going in. Now, this is the lining right here, these tight junctions. lining your gut wall. So basically what you're seeing here is, say, this part of the digestive wall, okay? But think about it as a tube. So you're also going to have another layer up here of these, right? So you're going to have a layer here and a layer here, which creates the top and the bottom, and then food goes through the middle, okay? Now, what you're seeing here are these junctions. Remember I talked about these tight junctions here? So that's a good look right there. That's a good, healthy gut wall. What happens is, if your foods are broken down properly, because I'm eating good food and I'm breaking them down with good hydrochloric acid and digestive enzymes, your protein, fat, okay, so protein, single amino acids, your sugars, right, in the form of glucose or fructose or whatever, and your fats, which are in the form of fatty acids and glycerol, will start permeating. You see where my pointer went? Through this wall into the bloodstream. So where my pointer is the bloodstream, and it'll start feeding your cells. Okay, that's what should happen. And here should stay your toxins and chemicals and pathogens, and then that should get to the liver and be detoxed, and you're good. However, if you look to the right here and you see these junctions here, those junctions are now wide. So the junctions here widen, right? And they start doing this. And now more things can get through. And when more things get through, like toxins and pathogens and let's see, alcohol, right, can get through there, and you name it, right? Whatever can get through that tight junction. Now, when it's in the bloodstream, it becomes very inflammatory, because the human body's immune system doesn't recognize those things itself, because they're not supposed to be there. So it's just like having a bacteria or viral infection in your system, or a bacteria or virus, and the immune system will constantly react to it. Okay, so leaky gut is just this: these tight junctions widen, and then when they widen, too much stuff gets through, and it creates copious amounts of inflammation. The other part is, if I'm not digesting well, and my proteins aren't in single amino acid form, and I don't have good breakdown of my carbs and my fats, I'm going to have malabsorption and malnourishment, because those big particles, the human cell can't use those big particles as food. So I had a patient today, low on almost everything on our NutriVal test. Her gut was slammed. She's basically eating and taking supplements, and they're not doing anything. She's not absorbing them. And it showed it on her NutriVal test. She had major absorption of byproducts or metabolites, and major dysbiosis. So before I give her all these different things that she's low on, I have to fix her gut. Makes perfect sense, right? So she's going to get better nutrient. She's going to have less inflammation. It's going to help her heal from her, as one part of this, it's going to help her heal from cancer, because we're going to get her gut better and slow down this inflammatory process and feed her cells better. Now, I'm not saying it's the only thing that we have to work on with her, but as you're doing a well-rounded, detailed plan and approach, you have to look at everything, right? Any cause could be on the table that we have to clean up. The more fuels we take away, the less fire. The less fire, the less inflammation, the less free radical damage, the less oxidative stress, right? And you're going to start to be able to give your body the best chance to heal. I think I probably hit that pretty hard, right? So, did you know 68% of your immune system is in the gut? And we talked about your neurotransmitters. Those neurotransmitters make the brain work, basically, and they're synthesized by the bacteria in your gut. So if that bacteria is off, you're going to have a hard time with the brain, right? It's going to be slow. You're going to be lethargic, maybe poor motivation, brain fog, etc. So that is leaky gut. So that's that fourth R, right? Remove, replace, reinoculate, repair. So we need to repair that if it's going on. And there is testing, gang, that could do that. There's a really good lab that I like to use called Cyrex Lab. It's out of LA, actually. Maybe I think their headquarters in Arizona. But Raj Vedani is the immunologist that started it. They do a great job of testing for leaky gut. They do the food sensitivity testing that tests for IgM and IgG, and they'll test for raw and cooked foods as well. So these are some of the tests that I personally would do with a patient if I felt the need arose. Okay, so testing is a key. I always say, I was taught years ago, you can't fix what you don't find. So you need to test it. Well, There's some stool ecologies. I know it's not the prettiest thing ever, but these are probably the 5 that I like to use. And again, there's other testing like Cyrex Lab has a multitude of different arrays that we could test the immunology of the gut as well. But the GI map is a really good one from Diagnostic Solutions. I'll kind of show you a sample report. I crossed this person's name out. GI Effects from Genova is a really good test as well. Doctors Data has the GI 360. Vibrant Wellness, the Gut Zoomer, is really an all-inclusive test that we might use. And then Viome has a really good one too. It depends on the patient and how much data I think I need to collect, and it's dependent upon how bad their gut is. So if I want, the full gamut, I have to look at everything and they're really, really sick, I might do something like the Vibrant Wellness Gut Zoomer. But today I went over this with the patient. It's the GI map test. So on page 1 here, and let me switch out of this. I'll stop sharing so you maybe can see a little bit better, and then I'll go back if I need to. Okay, so the GI map here test, the first page is all your bacteria pathogens. So it's everything from E. coli, Campylobacteria, C. difficile, which is there's a toxin A and a toxin B. And this patient just happened to have C. diff, right? So that can be really detrimental to gut health, create a lot of inflammation in the gut, create a lot of diarrhea and irritable bowel and things like that. The second page will test for H. pylori, okay? It'll also test for normal gut bacteria. It will test for what they call phylomicrobiota, another way to test the gut and its components. Bad bacteria is listed here. So this person, these are usually in red, which means they're elevated. This person doesn't have a lot of elevated bad bacteria, which I was surprised because there's a lot of symptoms, but I think the C. diff is maybe creating those. And then potential autoimmune triggers, and it'll go into fungal and yeast like Candida. It'll talk about viruses and check for those. And on this page, it will look at your parasites and your worms and things like that. And then down here, it tests for things like elastase, which is an enzyme from the pancreas to see how your pancreas is doing. It will test for secretory IgA, which is the immune system of the gut. It'll test for calprotectin, which is an inflammatory marker that we want to look at. So it's just a brief synopsis, gang, but this is a test that I typically use or one of the others when I want to find out why somebody's having some gut issues. And once I find that out, I can get very specific on the 5 R's protocol. What do I want to do for their diet? Some people have to go through maybe doing a FODMAP diet and some sensitivity, removal diet where I'd have to take some things out, etc. So the diet gets specific based on this. Then their enzymes get specific. But really what is super specific here is what kind of bacteria I want to put back into their gut. So just taking a general probiotic or just taking a general prebiotic might not always be the best answer because I had a lot of patients say, I take probiotics and I get a stomach ache. Well, that's because you're taking the wrong ones and there's probably SIBO in there and they're feeding off of those bacteria. So we have to be careful about what we do and what we prescribe. And the GI map is something that really does a good job with that. So, and there's those other tests. Let me go back here, sorry, and share it. Oh, here. All right, so the GI effects, again, another probably 6, 7 page, 10 page test, the doctor's data, Vibrant Wellness, all really good tests, okay? So that gives you an idea of the gut in general, right? So let's do a quick, let me see here, where'd it go? There we go. So let's do a quick summary, right? And we went over this. So the fuel of the fire, right? So gasoline, propane, diesel fuel, dumping on your campfire, which creates an inferno or something like that. The immune system gets dysregulated. You get your free radical damage, right? Your atoms lose the electron, create instability. The unstable atom then causes oxidative stress. So the point I'll make is with that, if there's enough stress creating or enough fuel creating this damage, then that's where again, the overload principle, right? People ask me, what do I think has happened over the years? I just think we're overloaded. Bad food, bad chemicals, stress everywhere. I just think our bodies are beaten up, quite heavily. And all this takes place because we're inundated with too much fuel to the fire. That's the best way I could put it. And so again, more free radicals, more oxidative stress, more damage to the cells, and then more potential for cancer. And I think that's a pretty good synopsis there. And again, the gut being a big deal in this process. So the takeaways, right? I say this at the end of every cancer conversation we have. Proper testing is going to create an individualized plan. So remember going back to the RGCC test and the nagalase and the D dimers and the cancer antigens, things like that. That's going to allow you to figure out the star phase, kill phase, oxygenation phase, and an alkalinity phase, right? And then we want to boost the immune system as we go through this process. Just makes too much sense as to why not. And then get rid of the fuels or the causes, right? So again, the rest of the class and the conversation will be designed or based around all the different causes. I'll have Liliana on next time, and we'll talk heavily about the different diets and and she's really good. And we'll talk about the different foods. We may have her on for a couple of weeks, I'm not sure, but I think it's a good segue to have her on next time. And then we'll get into the infections in the body. What bacterial infections? We'll talk about Lyme's disease. We'll talk about the oral cavity and what happens in the oral cavity with cavitations. We'll talk about viruses like Epstein-Barr, which is very big in the research. We'll talk about the mold and the candida. We'll go down that path. We'll talk about EMFs. We'll talk about toxins and non-metal toxins and so forth. Each of the next classes are going to be individual causes, so you can learn how to clean up that cellular environment, right? So hopefully, gang, that was helpful. I think it's important to understand the gut. I think it's very important from an inflammatory standpoint, as I think I proved, and how that affects everything, quite frankly. So gut, major player. All right, so let me see if I can do some question and answers here. Let me go Q&A. Perfect. Leaky gut always returns after sealing it and healing crown. So Sandra wrote, my diet is perfect, ALP paleo, which is great, and leaky gut always returns after sealing it and healing crowns. Well, if it's returning, Crohn's, if it's returning, there's still something going on within there that's being missed, because leaky gut, now again, could it be the brain part of it? Maybe. Could it be the stress part of it? Maybe. But there's something going on there that's driving inflammation that then causes the gut to, that leaky gut to open up again. So there's something being missed there. How long does it take to repair leaky gut? What is the fastest way? Water fast? No, the leaky gut can take, for some people, months and months and months. Some people 6 months, 12 months, some people a month or two. It really depends. But I will tell you, there is no quick way to do it. You have to do the 5 R's protocol, right? So remove, replace, reinoculate, repair, and remove infection. If that's not done, leaky gut, and look at adrenals and look at brain health too. So if those aren't done, leaky gut, and that could take months and months, okay? So it's not an easy proposition at all. All right, so chronic malabsorption, deficient in all fat-soluble vitamins, no pancreatic insufficiency, colonoscopy clear, terminal female hereditary, placebo positive, antibiotic used young. Yeah, my fecal. Yep. In the clinic week, I don't take OTCs. Yeah, again, Beth, your question, it's in the 5 R's. You either have, we've got to look at that ileocecal valve for sure if you have SIBO, because that's not working well, which means your vagus nerve is not working well. So that has to be looked at in conjunction with the big picture as well. But the 5 R's is really your guide. Remove, replace, reinoculate, repair. It's just finding somebody that knows how to administer that process, test the right things, and then administer the process. And if you have SIBO, they have to work on they have to work on the neurology as well, because it's in part because of that vagus nerve, a neurological issue as well. Issue last 5, replay. The replays, yeah, I'll work with Dan on making sure we come up with a really good solution for the replays for sure. Colonics are recommended. How often? Just depends. I don't recommend them for everybody. It just depends. So it's hard to, Marley, I apologize, but it's hard to answer that question. Um, so prevention, what type of tests are recommended yearly? If we're talking cancer prevention, your RGCC test is phenomenal, right? So the RGCC has a couple different types of tests that you can do. One is just the Oncotrace, which is just the circulating tumor cells. That's the one that I would do personally, or have done, to make sure that I'm at zero, right? So if that's zero, and then say your NAGLase and PHI and just some of your general blood work is clean, that's a pretty good way, from a testing standpoint, to make sure you're okay. And then, of course, if for women, your my wife would always do her breast ultrasounds plus she'd rather do an MRI, so she did her breast MRIs consistently, and so that's, from a preventative standpoint there. But if you're talking about prevention health wise, then it's going through the whole, you know, you're testing to make sure you're good, immune boosting, and then of course working on the causes, right? Making sure hormones are good, making sure your toxin levels are good, making sure all those things that I talked about cause wise, gut is good, foods are good, etc. Glutamine to help the gut around chemo time. Yeah, there's definitely glutamine, glutathione. These things are in the literature that it could feed cancer. But again, we have to look at it because chemo really, really beats up the gut. I don't necessarily have a problem with a little bit of glutamine here and there, but I will tell you, Christina, there's a really good product that's glutamine free called Ion Biome. Used to be called Restore. That I love it, and I would recommend that. That's a product that I think you'll do well on. That I could give you. But Ion Biome is a really good product that I give to my chemo patients, and it does them really, really well. And it doesn't have the glutamine in it. So if you're at all worried about it, then use the Ion Biome. But if not, I think a little bit of glutamine around chemo time is definitely helpful, along with things like aloe vera, marshmallow root extract, the glycerized licorice, really good. There's a couple products out there that have a lot of those in it. Your main supplement players have products that help heal the gut. All right, so Miss Terry, let's see, diagnosed 720, high grades. Okay, metastasized surgery, removed it. Doing various things to get my CA 125 back to normal. One is daily coffee enemas. Yeah, very good. When doing those for almost a year, I found parasites. Yeah, my local eye doctor tested and always comes back negative. I know what I put in the test tubes. I try to eat anti-parasitic diet, but nothing has changed. Okay, so again, hard question to answer, but if you stay within that 5 R's protocol, remove, replace, renoculate, repair, right? You're going to create an environment that's conducive for parasites not to grow. Gang, if parasites are going on, this is my contention, this is my opinion. You don't have to listen to it or agree with it, but if parasites are there, you are basically trying to get rid of them is tough, I should say. So I personally would rather send them to one of the docs here to prescribe some medications, and a series of medications that can kind of paralyze them and starve them and get their, the different stages of them. But I haven't had much luck with natural parasitic remedies, and I think I'd rather get rid of them medically, believe it or not, as natural as I like to be. RGCC test at age 29 just for prevention. That's a great question. I did not have the RGCC. I didn't even know about the RGCC. RGCC is something I learned at when I started here a few years back. So, but I've had it done recently for prevention. And then I had somebody really close to me that had a lumpectomy, radiation, because it had a high percentage chance of helping the small tumor that she had in her breast. Came here, just had her RGCC done last week, and it's clean. It's zero. That's a good way to use the RGCC test as well, gang. After you get done whatever, let's test it, because if those cells are still migrating and circulating, we've got to get rid of them. So the plan isn't done, even though testing may say, doctors may say, hey, you're clean. Until that RGCC comes back personally and some of these other levels are down, I'm still working personally. Let's see, would have nausea and coffee grain vomit. Could be gallbladder, liver, nausea and coffee grain vomit. Yeah, yeah, could be something to do with the liver and the gallbladder potentially. Daughter has thyroid nodule. Doctor suggests do a PET scan. She's 14. I'm concerned about the radiation exposure. What's your thoughts? Um, yeah, I mean, what about, so they did the ultrasound, they found the nodule. She's 14. That's a tough one. I honestly, Natasha, it's hard to answer that one because I would be injecting my opinion and going against, a doctor's order. But I would definitely, let me say this, I would definitely look at some alternatives and look at other doctors to take a look at that. I know thyroid cancers, if there are cancerous, very high percentage chance of healing from that. I don't know your daughter's other symptoms or things like that, so it's kind of difficult, and I certainly don't want to get in any trouble. But I would have a second opinion or third opinion on that. Is what I would do. Um, yeah, RGCC test. I love it. I don't. Yeah, age-wise, I think it's good for anybody just to make sure everything's good. Keep up on it. Prevention, or early detection is the best form of healing, or the easiest way to heal. So yeah, I would definitely do it if you're 29. Just do it once a year, once every other year, just to make sure, and you have a good baseline. So when I take supplements meal, I drink about 20 ounces of water over the course of the meal. Yeah, I mean, it just depends. You'll probably create a little bit less acidity in the stomach, so it might be a little bit harder if you drank all that water at one time. So the question was supplements with a meal, drink about 20 ounces of water. If you feel pretty good, you're fine. I might take a little less water in, keep the acidity, let things break down first, and then drink some water. Um, so it is advised to take digestive enzymes. I personally think so. Those enzymes are really necessary for other, facets of health and healing. So I, real quick, gang, when I'm working on things preventatively, anti-inflammatory is my number one goal. Gut health is kind of 1A, and liver function is 1B. So those are my big three. So I take enzymes, right? Heard it funny. I read this, so funny. As you get older, right? So I remember being in college, we would get home late and eat whatever we wanted. I'd go to sleep and sleep like a baby, right? I can't do that anymore. And so I read this thing. It said, or meme. It said, you're getting old when you have to pregame a cheeseburger with digestive enzymes, right? And I understand cheeseburger, right? Don't, but it's the truth. It's like now I got to think, okay, I need to take my enzymes to break everything down properly, especially later at night, and especially cooked foods. So, especially with cooked foods, I would definitely do digestive enzymes. I don't know if I'd worry too much about it with raw, unless you felt the need, but definitely with cooked foods, I think it's a big deal. When you cook foods, you just cook the live enzymes out of them. So it becomes, your body has to work a little bit harder. Um, yeah, the ability to have the slides, Constance, yes, we'll send replays. I'm going to make the replays available. We're trying to figure that out. I know I've said this all the time, but then 2 weeks go by and I'm so busy. And Daniel and I, our IT guy we don't have a chance sometimes to figure this stuff out, but I will figure it out so where there's somewhere where all these are stored and then you can have access to them. I definitely want that to happen. So, are probiotics good for your sensitive gut while undergoing chemo? Again, Adnana, I think, DeConti. Sorry, I shouldn't probably have said your last name, but I don't know, right? It could be if they're the wrong probiotics, but I certainly, um, they could be sensitive. It just depends. So again, if you're taking some and you don't get gas or bloating, it's probably okay to take them. But yeah, I personally have my patients doing the 5 hours when they're doing chemo, but I test it first and then I figure out what's best for them. The brain, like Brain Harmony or Evox. Yeah, yes, somewhat, Marley. As far as how do we address the brain, there's functional neurologists out there that can assess the brain, and sometimes I'll refer to them, but I can always get a good idea. But there are exercises that strengthen certain areas of the brain, that it's the brain's like a muscle, you use it or lose it. So yeah, something like that. But there are specific exercises that can be done for the brain by functional neurologists if the brain's an issue, uh, factoring in gut health. Organic soy, good for ovarian cancer. Soy, because of the estrogenic effect, I might lay low on the soy, and the ovarian and breast tissue, uterine tissue can be estrogenic or estrogen involved. So I would probably, just be cautious of organic soy. Maybe if it's more fermented, it'd be okay because it's easier to digest, but you're still looking at potential estrogenic effect. Carrie, is it possible to have tumor and not have circulating tumor cells? Possible. Yeah, it's possible. Is there alternative treatment to treat fluids in the lung? Oh, good question. Alternative treatments. Well, you got to figure out why the fluid is there. I think that's probably number one. And yeah, it's really, honestly, Angelina, it's probably based on cause. So it's hard to answer that. I know I hate to do that to you, but touch base on water fasting. What about fibroids? Yeah, fasting. I'm a big fan, depending on water fasting with, if it's 24 hours at 48 hours, I think it's a good thing, even getting into 3 days, but I would do it under the guise of a very trained provider that can help you with that, because, these fasts that people do, if their adrenals are shot, they're going to go into hypoglycemia very quickly, and that's not a good thing. So they got to get the adrenals fixed first before you get into doing too long a fast. So, and then fibroids, yeah, fibroids are typically driven usually by maybe an imbalance in hormones, not enough progesterone, maybe too much estrogen dominance we typically see with those. So I would definitely look at a good hormone panel and see. GCMF that you would recommend for high nagalase. Also, do you recommend? Yeah, the GCMFs, if they're high, and that's kind of the nagalase question. Salicinium is really good. Bravo suppositories are really good for knocking those down. So hopefully that answers your question. Just wanted to see clients in the U.S. No, we have international clients for sure. Do you know of a Dr. Australia? Do not know of one in Australia, but we definitely see international clients, Yasmin, for sure. And they could do Zoom. So United States, the law changed, not really the law, but the legality of telehealth now, if you're out of state of California, you'd have to come here to get evaluated and a full plan put in place, right? Like doing the testing and things like that. We could still do Zoom with people outside of the state of California in the US, but we wouldn't be able to give them a full plan. You'd pretty much have to come here, get the testing done, and then 3 weeks later we do the full plan and give you a good comprehensive, state-of-the-art kind of step-by-step plan to hit all the 4 pillars. But if you're out of country, we can do a Zoom for you too and help you as well. Gang, it's always tough because coming here is really the best answer without question, because patients try to piecemeal some of this, and it's very, very difficult to do. It's just very difficult to do. So we always encourage, if possible, patients to come here, but we'll do whatever we can to try to help. Aaron, how do you frequently test and see Lyme-related bacterial and co-infections? Yeah. So there's that doctor I talked about out of LA, Raj Vidani. He came up, he has a new Lyme test that I love. I think it's Immunoscience, really thorough. So that's how we've been doing it lately, to test for Lyme-related bacterial co-infections. And then EBV and the viral loads, we test, we could test that blood, we could test that a number of different ways. But yes, we want to see at some point, based on the history, we want to know where the priorities are and start working on the causes. And the priority list comes basically from the patient. Like, I've had this, I've had that. It's been really high in the past. Okay, we've got to start looking at that and seeing if we want to bring that down. So Candida, once we work to heal it, how do we maintain it? Yeah, good. So again, if somebody has Candida or any infection, we have to do the other R's of gut health almost simultaneously. Kill the Candida or knock it down. Candida is a normal part of our gut terrain, but not overloaded, because then it becomes immune. The immune system has to react to it. But we knock it down, and then we build up the good bacteria in there. If we build up the good bacteria, it can keep Candida under wraps, right? So the 4 or 5 R's is the answer to that one. Microbiome, we talked about the testing, right? So you test the microbiome, stool ecologies by some of the ones that I mentioned. You're going to need a healthcare provider to definitely guide you on that for sure. Clean, healthy diet. Are lentils, beans okay? Yeah, I soak them. I think that, there's the whole lectin thing. Lectins can create inflammation in some people. So if you're doing beans, soak them overnight in say some vinegar and water. Get that lectin layer off of there. Rinse them, eat them. Should be fine. But really good source for good nutrients there. Infrared saunas, love it. Yes, infrared more than traditional sauna for sure. Love. We have two of them here. Love the concept, of infrared saunas for infrared. Once your gut is on a healthy track, how detrimental if you have a slice of pizza or a glass of wine? Thinking about being realistic. Well, yeah, I think it's great. Um, I think if you, it's like depositing. If I deposit in a bank account, once in a while I can get a withdrawal. So if my gut's healthy, and I do this sometimes, I'll definitely have a little bit of this or a little bit of that, but I know I constantly work on my gut. I take my enzymes, I'll take some probiotics, I'll mix them up a little bit. I will take my gut ion biome, and I've worked on it for years, not every day, but consistently over the years, right? Like the tortoise versus the hare. And because I do that, I have less sensitivity reactions to foods. So I can get away with that. If I have too much, no good. I feel it. I get achy and sore and all that. So I minimize my exposure, but because my gut's healthy, I can get away with it. So that's a good question, Zoe. All right, so let's see. Let me see time-wise. All right, guys, it's 22 after. Let me take one more. Immunotherapy two for stage 4 kidney care, about 14 months. Specific considerations counteract the negative impact it is having on my immune system, even though I have had a complete response to treatment. Yeah, I mean, you want to do, based on the 4 pillars, Warner, you certainly want to do things that can help support, right? Like again, if your gut's better, if your liver's detoxing better, if your health, the foods are really healthy, if you're doing some specific immune boosting therapies, all that make a very big difference in how you tolerate everything and the negative downside to some things, right? So it's kind of the whole 4 pillar approach. I hate to be that vague, but that will help somebody get through it without major downside. So last one, Joanne, I've heard caffeine in with green tea affects the gut health for about 6 hours. Is this true? I want tea for antioxidants, but don't want to mess with my gut health too. How do I balance this? Yeah, I green tea, white tea, love. If you could do more of a lower caffeine and or decaf, fine. If not, a little bit, 20, 30 grams. I don't think it's going to be a big deal, or milligrams of caffeine is going to be a big deal here and there. I definitely, once in a while, will do some organic coffee, just maybe a couple ounce, maybe a few ounces here and there, and I love it. So I think it's okay as long as everything else is, in relation to everything else, where you're doing a good job on your gut health. I think you'll be okay. So when a new cancer patient comes in, do you typically see them? Sherlyn, yeah, I will see them for a couple reasons. Number one, when a new patient comes in, I sit down with them to make sure that I can help quarterback their plan. I like to have every I dotted and T crossed for them. And then I also make sure that they understand the plan really well, because I think personally, the better you understand it, the less fear and anxiety, right? So that's one thing I do. The second thing I do is review the NutriVal test. So one of the tests that we do, NutriVal, pretty much a metabolic, snapshot of your cellular environment. I'll do that for people and review that, and then I'm part of the pillar 4 approach. So I help with gut health, and I help with diets, and I help with testing mycotoxins and toxins and adrenals and thyroid and all that. So yeah. So Rebella, recommend for diarrhea caused by cancer chemo, do the gut ion biome. It's called ion biome. Really good. Liquid, take it on an empty stomach, maybe a tablespoon twice a day. Really helpful. All right, gang, I know 25 after. I'm so sorry it's so long. I'm sorry I didn't get to a lot of your questions. We're still working on a moderator. I had somebody text me or email me. Margaret, I did get your email. that she would help with moderation. So maybe we can do that, eventually as well. So sorry, let me get out of here, knock that out. Okay, gang. So if I didn't get to your question, I apologize. We're working on all that. Hopefully you enjoyed the context of the talk, the conversation tonight. Again, gut health is imperative. If you have any questions, any concerns, let me know. And then, yeah, real quick, let me just show you in case. Well, I don't remember what happened there, but you share. You see. Whoops. Sorry, gang. I'm just letting you know in case. Let me get down to the end here. You have any questions or concerns, right? So let me just give you some numbers and websites and things like that, just in case you have any questions or concerns. And where did that go? Sorry, gang. I apologize. Let me see here. I don't know what happened. My goodness. There we go. All right, one more. So if you see here, sorry, I don't want to mess this up again, but if you're just looking for preventative, you can call the Center for New Medicine number to 949-867-6419 or the cfnmedicine.com, really good website. If you have cancer inquiries, right? cancercenterforhealing.com is the website. Dana is at 949-867-6374, okay? And then anything related to the supplement store, shopcfnmedicine.com, 949-997-0821. Gang, the reason I give these at the end, because inevitably we get a ton of calls the next day inquiring about consultations and things like that. So I know you're going to ask, so I give you these. If I tell everybody, if I'm selling anything, I'm selling you on the 4-pillar approach, that plan. Whether you do some here and some elsewhere, I mean, I think the resources here are the most beneficial out there. But that's the idea. It's the plan that I want you to be really, really anchored to, because I definitely believe it gives you the best chance to heal. So, okay, we'll see you in a couple of weeks. Any questions, concerns, let me know. You can call and ask for me. I'll try to help you out as best I can. And we'll see you in a couple of weeks, gang. Have a great rest of the week, and much love to you all. Appreciate you. Love the comments. Have a great one, gang. Have a great one.